I'm Douglas Massi, and whether you're a Medicare recipient or maybe an insurance agent who's learning about Medicare Advantage, this video should absolutely speak to you. Today, I'm going to be going over some of the pros and cons of Medicare Advantage plans and how they actually work. Guys, I totally understand how Medicare can be kind of complex. Therefore, today we're going to break this video down in a way that anyone can understand. And please, give this video a thumbs up right now and subscribe if you're new. We're putting out new insurance content and training videos every single week. When a Medicare recipient who has Part A, known as hospital insurance, and Part B, known as medical insurance, enrolls into a Medicare Advantage plan, which is known as Part C, they will at least have the same insurance that they got from Parts A and B, through the original Medicare, and in most cases with additional benefits. So let's just start with some of the pros of having Medicare Advantage plans. Since Medicare Advantage plans have at least, I want to say, what is offered from that original Medicare Parts A and B, in most cases, again, they have at least a few additional benefits, including possibly Part D drug plans. Medicare Advantage plans, in simple terms, are actually bundles of insurance benefits, and all plans are a little bit different. Some plans do have like dental, vision, and maybe hearing insurance coverage, while other plans may not have these benefits, but like maybe instead they may have something else like prescription drug coverage and a gym membership, or even some type of a cash back incentive that's really designed to replace some of that Part B premium that most of our Medicare beneficiaries have to pay for their Part B insurance. Generally, guys, just an FYI, if you have Medicaid, you don't make that Part B insurance premium. This would make the cost of your Medicare Advantage plan less money than if you stuck with original Medicare. You see, some of the Medicare Advantage plans do have an additional monthly premium, and some of them have a zero dollar premium. And in my area, most of the good plans have a $0 premium. However, since the plans all do vary from plan to plan and area to area, some of the plans that I have may not be available to you. This is why it's so important to have an insurance agent that actually knows the local market, your local market if you're a beneficiary of Medicare. And if you're an insurance agent, this is why it's so important that you become an insurance broker that offers most of the insurance carriers in your state and areas that you sell in. With some Medicare Advantage plans, your cost sharing might also be less than they would be with original Medicare. A good example is that, like with original Medicare, some doctor visit copays could cost you like 20% of the regular visit fee. While with some Medicare Advantage plans, the copays are between $0 and $10, which happens to be less than original Medicare in most cases at least. Another great feature with a Part C Medicare Advantage plan is that these plans will often limit your maximum out-of-pocket expenses. So let's say you end up, God forbid, in a hospital. Once your bill hits like a certain amount, you don't have to pay any more money out of pocket for the rest of the year. In many states with original Medicare, there is no maximum out of pocket. So you can literally end up paying thousands and thousands more per year with original Medicare than you would with a good Medicare Advantage plan. Let's say that you decide to stay with your original Medicare and you would like to get all the same benefits that you could get with the Medicare Advantage plan. You would have to pay for a Part D prescription drug plan, and you would also need to purchase a Medicare Supplement plan, which a lot of us call Medigap. This can get very expensive, and unfortunately, in some parts of the country, maybe your only option, believe it or not. Another great benefit of having a Medicare Advantage plan is that these Part C plans coordinate, and they actually do, guys, with your healthcare providers. Your typical Medicare Advantage plans are managed care and have networks of contracted health providers. Examples would be an HMO, healthcare maintenance organization, and a PPO, preferred provider organization. An HMO plan requires you to pick a primary healthcare physician, your primary doctor, whose job is to actually help coordinate all of your care. Medicare Advantage HMO plans that include the Part D prescription drugs that I mentioned earlier may also have medication therapy management, which can be a huge convenience and a valuable aid for your health. The con for this type of plan is that you will need a note from your doctor if you need to go to a specialist. As with like a PPO plan, you can usually just go straight to a specialist without seeing or speaking with your primary physician first, without them having to approve the specialist visit. This makes the HMO designed for your primary doctor to be more hands-on for your health than you, the client, which is, as I explained, a lot different than when you're with a PPO plan. With a PPO, I feel that these plans are really better for someone who has, a better and clearer grasp on their health conditions than maybe others would have. It's all about you having your preference in the type of plan that suits you and really your personality best. Medicare Advantage plans can be a one-stop shop for your health and prescription drug medication needs. If you think about it, with the right plan, you can have dental, hearing, and vision insurance all bundled with like a gym membership, and even have your prescription drugs taken care of, along with, that Parts A and Part B, the hospital insurance and the doctor medical insurance, including specialist visits, all in one beautiful insurance package. So with all that behind us, let's move on to covering some of the cons, the negatives about a Medicare Advantage Part C prescription drug plan. To me, the biggest negative with Medicare Advantage is that in some counties and certain parts of the country, you might be restricted and or limited to certain healthcare providers and certain doctor networks. As with like original Medicare, you can literally go to any doctor or facility that accepts Medicare. And here, I'll use my doctor as an example. He only takes certain Medicare Advantage plans and doesn't take most plans. But anybody with original Medicare can go to him. So if you were traveling to Indian River County, Florida, where we live, and you needed to see a doctor, as long as you have original Medicare, you can give my guy a visit. But let's say you come here and you have a Medicare Advantage prescription drug plan, and my doctor is not in your network. Since Medicare Advantage plans are more restrictive, you most likely, you probably will have to pay more money out of pocket than normally you would, or your plan might not cover any of the costs of the visit at all. Not only that, but your out-of-pocket costs may not even be applied to that maximum out-of-pocket costs, that I mentioned earlier. Another con of a Part C Medicare Advantage plan is that you may need a doctor referral for certain services and or procedures, including specialist visits. Medicare Advantage plans try to do their best to prevent the misuse and or overuse of healthcare through various means, including prior authorization for hospital stays, home health care, certain complicated procedures, and medical equipment. This means that the plan is more likely to prove justification. In other words, it needs to prove justification, as with original Medicare. It's usually not as restrictive, which gives the doctor more leeway to help their patient. And finally, Medicare Advantage plans have specific service areas that vary from county to county. What this means is that in order for you to enroll in a specific Medicare Advantage plan, you have to live in that plan service area for at least 6 months of the year. If you are one of those people who divides your time between 2 different homes in 2 different states or 2 different counties, this requirement may be hard to meet, and it will make it hard for you to find a plan that would work for you. So in this situation, for you to reap the benefits of a good Medicare Advantage plan, you will have to figure out a way to follow the Medicare Advantage Plan rules, which can be a little bit difficult depending on what state you're living in. So if your client is about to enroll in Medicare for the very first time, it's important for you to review all your options, because remember guys, Medicare plans and benefits are constantly changing and being updated. I know that Medicare tends to have a lot of moving parts and can be a little confusing, so whether you're new to Medicare or you're already enrolled, it's good to review your plan benefits every single year so that you don't miss out on some important plan benefits that either maybe you didn't realize were available or that maybe recently became available in your plan area. Aha! This means you could actually be able to increase your plan benefits without having to pay for more benefits by simply contacting a good local insurance agent. For more information on selling Medicare Advantage as a completely independent insurance agent, along with having access to our free exclusive Medicare Advantage Leads program, just email me at doug@ufesonline.com. Remember, when you put the needs of your clients first, everything else will usually fall right into place. Now, get out there and do something good for somebody today. Happy hunting.